Hey, I'm Hannah. I'm the nurse practitioner here at First Care Women's Clinic. Thank you so much for being involved in these classes. We're very excited to have you watching these and educating yourself so that you can take the best care of your child. I want to thank you just for choosing life for your child and know that we are here to support you and we are here to just be whatever we need to be for you. So feel free to reach out to us as you need to, but we're so excited for the journey that you are on and the journey of parenthood that you're going to be in. I wanted to just talk with you today about postpartum, and this is the period after you have given birth, and it is the actual postpartum period is considered about 6 weeks after the delivery of your child, but it begins from right after you have given birth. So while you're still in the hospital, this period is probably going to seem a little bit intimidating. You have had the baby, and then in that actual period after labor, there's going to be a lot going on. There's going to be a lot of people in the room. They're going to have to take your baby for a minute and get them just kind of cleaned up and check their health. They do this thing called APGAR scoring, where they'll look at your baby, see how they're breathing, how they are crying, all of that kind of stuff. And they'll also be putting like the little wristband on the baby, and they'll be checking you too at this time. So there's going to be a lot going on in the room. There's going to be a lot of people in the room. But then after that, there's a very important just time period right after that where you're getting to bond with your baby. They're doing the skin to skin, and you and your partner are going to get to spend time with your baby. And one thing that I would say during this time, it's just important for you to be able to have that time to bond. A lot of hospitals are now doing this thing. I know it's they call it like the golden hour. It's this time period where you get to have that time that's uninterrupted with your child, where you don't have to have, maybe if you are able to have family at the hospital, maybe not have everyone come into the room, because this is an important time for you and your child. And so you don't have to have all of these people in the room, but you can have that time just to bond, because that first bit of bonding is very important. But then you're going to have time where you are healing in the hospital, and people are going to be checking on you, and people are going to be checking on the baby constantly during that time. A lot of hospitals are now allowing you to keep the baby in the room all the time rather than having to go to the nursery. That is an option, but a lot of times they'll have you keep the baby with you at the bedside, and you'll get to have a little bit of assistance during that first time period, where you also need to recognize that you're going to need help, and you'll have the nurse who's going to be checking on you too. She'll be checking your vitals and checking on your pain and everything like that, but you're also going to have that help to see just adjusting to that parenting. It's funny just because you've had this baby, and then soon after, within a couple days, depending on exactly what all's going on with you in that time period, they're just going to send you home, and you're responsible for this baby now. And it's a pretty big adjustment. For those of you that don't have kids, it is a huge adjustment to learn just how to spend your time taking care of a child, and also having to deal with your own physical recovery. If you already have kids, you know that this is just a real time of adjustment, but also this might be your second child, and that's also going to be a time where you have to just give yourself grace, that you're having to learn how to have a child who might be running around while also taking care of a newborn and also having to take care of yourself. So the biggest things that I really want to talk about during this is be patient. Be patient with yourself, be patient with your child, be patient with your partner, because this is an adjustment for everyone. You are going to be dealing with some physical pain and just discomforts of the postpartum period. And your child is new to this world. They can't communicate with you the way that other people can. So there's just crying. And I know in the newborn class we talk about a lot of that, but having to learn your child. And even if you've already had children, you know, every single child is different. And the way that you will bond with this child is different. The way that this child will communicate different needs might be a little bit different. And so you're going to have to learn that. And it's okay that that's going to take just some time to figure out. You might have family who wants to be around, and that is something that you just need to feel empowered that you get to decide who you want around your baby and when you want them around your baby. Because your priority as a mother or as a father is to keep your baby safe. And you just need to be able to, if someone wants to come and see the baby, just know that it's okay for you to say yes or no to them. It's okay for you to say things like, hey, can you wash your hands before you hold my child? Or just having certain things that you are and are not okay with, that you can learn how to communicate that to whoever is wanting to spend time with your child. But also know if you have support and people want to help you out, it is very important for you to have that support. You're going to be tired. You are going to be uncomfortable, probably some. And so it's okay if you need help. You don't have to feel like you are failing in any way if you need help from other people. That is normal. And so there are some things that might be the best way to be able to have people help you. You might want someone to help if your mom wants to be involved and she wants to come over and offer help. If you have another child, you can have her watch the other child so that you can attend to the needs of your newborn. Or if there's just dishes that need to be done in the house, or if you need help cooking, things like that are really great ways for you to have other people involved. But you can also just really take on your role of being a new parent during that time if you can have some help with other things. So do not feel like you aren't doing a great job if all of that seems overwhelming. But if there are people who are wanting to help, those are some really great options to give them to be able to help. So one thing that you can do before you have the baby is maybe make a list of some things that would be nice to have help with, so that when people do ask, that you could say like, oh, it'd be really great if you could drop off some food for us or something like that, so that you have options for people if they want to be involved, that you can give them just tangible ways for them to help that you feel comfortable with. Let's see. It's okay if you need to nap. Try to get a nap. Your baby is going to sleep a lot during that time period, just the first few weeks while you're still just learning this new role and getting more comfortable. Your baby's going to sleep a lot, so it's okay for you to also nap during that time as well. And it's important for you to recognize when you need rest and get the rest that you need. Another thing that's important is that you are getting just some good exercise, like just getting out and walking is a really great way that you can have bonding time with your child, maybe taking a stroller out for a walk. But it's also good for you. It's good for your healing process after you're giving birth. And having good nutrition is also very important. I'm going to talk more about certain things that you want in your meals, and we also have a nutrition class that we do. But it's important for the healing that you are getting a lot of protein and that you are getting, your fruits and your vegetables, your fiber, everything like that. There are also a lot of physical changes that are going to go on in this period. One thing that I do want to stress is that it is very important that you go back to the doctor. You need to have that postpartum visit. And by Medicaid, they actually just expanded the law here on what is allowed to be part of the postpartum period. And so now with Medicaid, there's a 4-month period that can be covered by Medicaid for you to get in for a postpartum visit. This is really important because in the prenatal period, you might have had some issues with if there's blood pressure issues, or if there are any concerns about your blood sugars, or any other things. If you have a C-section, it's very important that that gets looked at. Or if you have an episiotomy, which is where they have to do kind of like a slit there at the vagina to help with the laboring process. And it's very important to be able to check that there's not any infections and that you are healing well. But 40% of moms do not go to this visit. But that is very, very important. And it's very important that we can recognize early some issues that you might be having. And so I cannot stress enough the importance of you getting to that appointment and taking advantage of the fact that this is already paid for. So you need to be checked, because even though you're concerned about the health of your child, it's very important that you also recognize that your health is important, not just for yourself, but it's important that your health be taken care of because your child also needs you. If you're looking for some other information, the CDC website has some really good information about the physical changes that will happen after birth. So remember that you just had a 9-month process of pregnancy. This was a long period of lots of changes, and so it's going to take a while for your body to get back to what you're used to. One of the main ways that you see this is just the belly size. That's going to go back down pretty quickly. Like right after birth, you're not going to have a child living inside of your abdomen anymore. So pretty quickly that uterus is going to start to go down. Right after birth, you're going to see that uterus is going to go back to about like the belly button. And then you're going to see over that 4 to 6 week period that it's going to keep on going down. So with that, you're also going to feel maybe some cramping pain, kind of like menstrual cycles. Some might be stronger, but you're going to feel that cramping pain of the uterus as it goes back to its normal size. If you're breastfeeding, then you're going to have that release of the oxytocin, which causes that uterus to contract. As you feel that, you might also have some like bleeding, and we'll talk about that in a second. But as that uterus is going down, you're going to have that cramping pain, and it's going to take about that 4 to 6 week period for it to get back to where it's back to its normal size. And you can see in the book on page 66, it kind of shows you the change of the uterus size. So you're talking about that uterus is contracting, and I know in other videos we've talked about this vaginal discharge that you'll have. You might hear it referred to as lochia, and this is just as that uterus is going back to its normal size, it's kind of going to be getting rid of some of the extra lining that's been in there. And so you're going to have some bleeding. At first, this is going to be bright red bleeding, and you might have some clots as well, which it's normal to have some clots. Some things that might be more alarming is if you have clots that are bigger than like the size of a ping pong ball. Then that's when we're a little bit more concerned about that bleeding. Or if you are wearing a pad and it's getting soaked through more than 1 hour, that's concerning. Also, let me just note there that it's important that you wear pads and you don't use tampons. You should not be putting anything into the vagina until your postpartum visit. And then as that discharge changes, it's going to start off that bright red, and then you're going to see some like more brownish discharge, and then it'll be kind of pink, and then it'll go to this more white discharge. And this discharge should not smell. What you're concerned about is, people usually call this like a earthy, fleshy smell. But if you ever notice that it is like foul smelling, then that's when you need to be a little bit more concerned. I'm going to talk more about what some of the like red flags are during this period. But if you're having anything that just has like a foul odor to it, then you should call your doctor about that. The birth canal. So the vagina is going to just be stretched a lot during the labor process. And this is normal, but know that your muscles there, it's going to take a while for that to go just back to normal. And so again, this is something in that postpartum period that will be returning to normal, but it won't be normal really quickly right after. It'll take several weeks. One thing that is important, I don't know if you've ever heard about what's called stress incontinence. And this is like when you sneeze or cough, then you might leak a little bit of urine. And this can happen a lot of times after you have had a child because of the way that those pelvic floor muscles are. So one thing that you can start doing is what's called Kegel exercises. And these are these pelvic floor exercises where what you're kind of trying to do is use those muscles down in the pelvic floor to make it like you're stopping the stream of urine. So the same way that you would use your muscles if you like had started to urinate and then stopped that. These are some easy exercises that you can do. You can also Google like how to do these, but what you're wanting to do is use your muscles like you're stopping the stream of urine. And you can do this several times throughout the day. And that will help with those pelvic floor muscles, that they return back to normal and that they can contract like they're supposed to. One thing that you might notice if you're breastfeeding, then you might also have some vaginal dryness. This is normal, but do know that one thing that can happen with that is that once you do return to having sex, it can be very painful because of this dryness. So be patient, give it time, because what you don't want to do is to just cause a lot of pain there and to cause that area to just get like torn up. So you need to be very patient. You need to just really slow down if you're having a lot of pain when you're trying to resume sex. And you need to talk with your doctor before that anyways, because you want to make sure that you're in a time period where it's safe for you to resume sex. The hormones right after having a baby, they're still going to kind of be all over the place. It takes a while for your hormones to return to normal. So again, patience with just emotional states as well, because we all know that when we're having hormonal changes, there are just changes in us that we don't always love. So be patient with yourself. Be patient with your girlfriend if you're watching this, that you recognize that her hormones are something that she doesn't have control of. And this is also going to make for a lot of other changes as well. It's going to cause changes in the way that you are dealing with things emotionally. It might cause changes just with breastfeeding. Everything like that are going to cause other hormonal changes. And the most important thing that I want to stress to y'all too is the return of the menstrual cycle. And before you have had your menstrual cycle again, you might already be ovulating. So it is possible before you have had your period that you could still get pregnant. This menstrual cycle might be delayed. It could come back a few weeks after having your baby. If you're breastfeeding, some moms go the whole time that they're breastfeeding without having a period. But just because you haven't had your period does not mean that you cannot get pregnant, because your body starts releasing the egg before you start bleeding again. So if you were not wanting to get pregnant again, just be very conscious of that it is possible for you to get pregnant before you think that you're able to get pregnant. So that's also something for you to talk about at your postpartum visit, is that you are going to want to find other ways to put off ovulation if you're not wanting to get pregnant right away. Weight loss is not, it's going to happen. You're going to have some weight changes right after you have your baby, because you are no longer carrying your baby inside of you. So you will lose the weight of the baby and of the placenta immediately after birth. But there are still other changes that happened to your body. They're going to have you still retaining some weight. And like I said, you were pregnant for 9 months. You're not going to lose all of that weight immediately. It's going to take a little bit of time. So you don't need to get out and try like going for a run right after you've had a baby. One, you're not really going to feel comfortable doing that. But also, it's not the most important thing, is not losing all of that weight and getting back to what you were before having your baby. That's going to take time, and that's not going to be an immediate change. So it's important from right after you have your baby. I mean, I say like that next day, you want to be up and trying to get to walking around. Whether you've had a vaginal or a cesarean, you want to get to walking around, because the more walking that you do, the better it is for you in that healing process. Also, with that being noted, it is important, if you have someone who's there with you at the hospital, you need to ask for their help or ask for a nurse's help. And you'll be reminded of this in the hospital, that you can't just jump out of bed. You might feel lightheaded. You might have some possible bleeding, the more changes, and you'll notice that more too with that bleeding. When you're getting up right after you've had a baby, you'll notice that whenever you're standing, it's just the way that gravity works, you'll have some more bleeding. But because of that, you also have more of a risk of just being like lightheaded and everything like that. So allow people to help you. If you have someone there with you at the hospital, let them help you stand up. You're going to have to stand up slowly, but don't let that deter you from getting up and walking around, but allow that person to just be your support as you're walking around. If you want to go just walk around your room or maybe do a lap, then just you can have someone there with you, standing beside you, walking with you. But as far as exercise goes, once you're at home, don't try to do anything too strenuous. Don't get to doing like weightlifting. And especially if you weren't doing all of that before, then go into it even more slowly. And again, you'll want to talk with your doctor about what it is that you're doing for exercise and make sure that whatever it is that you're doing is good and safe for you to be doing at that time. But like I said, walking, taking your baby for walks, things like that are a great way for you to adjust to the parenting role and also adjust physically to everything. Your bowel movements are probably going to be slowed down for a little bit right after having a baby. Remember, for if you have had a C-section, then you have just had a major surgery and you are going to have abdominal pain. Regardless, it's going to hurt if you're going to try to go to the bathroom, because whenever you're like having to bear down to have a bowel movement, you're going to be causing some pressure there in that area where they did the incision. And so it's not going to feel great. This will be even more slowed down if you've had pain medicine. That's going to slow down your bowels. And so you need to make sure that you're getting plenty of water. You need to make sure that you are eating a high fiber diet. So some good high fiber foods that you can have is fruits, raspberries, and pears are really high in fiber. Vegetables, broccoli, green peas are really high in fiber. You can do grains, so like spaghetti or bran, or legumes if you do like black beans. All of those are really good foods to give you fiber. And walking around too will also help with getting those bowels moving. But also for women who have had a vaginal delivery, if you had to have an episiotomy, that's also going to cause a lot of pain when you're trying to have a bowel movement. So drinking water, getting those high fiber foods, walking around are ways that you're going to be able to still have that bowel movement, but it might be a few days. And then if the stuff that you're doing isn't working and it's been a couple days, you can talk with your doctor, but you could do some medications for constipation as well. That could be like Miralax or Colace, and that's really important. And having that bowel movement is also important because of the risk of hemorrhoids as you are bearing down more and having constipation and having those hard bowel movements. You might want to take something just to kind of help soften those bowel movements. So like Colace, something like that, to help soften that if you have hemorrhoids. And some other things that you can do with that is doing just some sitz baths, or there are creams that you can do if you do have like any kind of hemorrhoids or like the tears there around like the anus. You can put some creams on there, and you can get anything over the counter for that, or you can talk with your doctor as well about that. So the first couple days after having a baby, you are probably going to have some like muscle and joint pain because you are using muscles that you're not used to using. Remember, the whole laboring process, you are doing a lot of bearing down and a lot of pushing, and you are probably not used to using your stomach muscles, those abdominal muscles, and other muscles that you don't even realize that you're using. You're probably not used to using those all the time and using those for such strenuous movements. So it is normal during that time to have just a lot of like muscle aches and pains. So again, getting around and walking is really good for those, but remember that you don't need to be hard on yourself for these like pains that you're feeling, but just be patient. They go away pretty quickly, but do make sure that just because of that, you don't just stay in bed and lay in bed, but that you get to moving around, because that will help with all of that. But also, if you are used to exercising a lot and you're used to having like a nice flat abdomen, you aren't going to have that back immediately right after you've given birth. And it's also possible that you can have like some tears and muscles there. So again, don't be hard on yourself if at first you might notice that your muscles and skin don't look the way that you're used to. That is a normal change after pregnancy, and that again takes some time for it to return to normal. So skin changes with that too. Some of you might have some, like maybe some blotchiness from hormone changes to your skin, or you might have this dark line on your abdomen, and those things start to change in a couple weeks after having your baby. You'll see that your skin will return to the way that it was before you had your child. And then again, I actually already talked about the hemorrhoids, but just to also add on to that, if you do have hemorrhoids, some cold compresses to the area can also be super helpful. And those hemorrhoids are those areas around like the anus where you have just had these areas of like bulging veins from having to push because of the abdominal muscles and possible constipation that you have after pregnancy. So those are all the normal physical changes. I do also want to add that some other things that you might see, you're still going to have some, if you've had like some swelling of your legs or of your ankles, feet, that your body is trying to pull off some of that extra fluid that you had during pregnancy. So you might need to elevate your legs. So if you're not out doing stuff, I'd say if you're at home and you're just like holding your baby, it is good for you to keep your legs elevated on a table or couch or something, just to have those propped up to help gravity pull that fluid off of your feet. And then one of the things that people oftentimes are not aware of is that during the night you might have a lot of sweating because your body's trying to get rid of excess fluid. And so it is normal that you might wake up and there's just like sweat on the bed. You might feel like your pajamas are wet. That is normal as your body is trying to rid itself of fluid that you no longer need to have on you because you're not trying to support a child growing and you don't have to have that extra fluid anymore. Again, all of these changes are normal. There are changes that are not normal. There are things that are warning signs that you need to call your doctor about. And so I'm just going to read over these for you really quick. And these are really important for you to remember. And you'll be reminded of these when you leave the hospital. You'll probably get a call from your OBGYN checking in on you. And again, this is why it's important for you to return for your postpartum visit. These are the things where you need to contact a healthcare provider right away. That's bleeding that soaks through a pad every hour for 2 hours, foul odor from the vagina, a fever of 100.4 or higher, unrelieved incision or abdominal pain. So where they have done either an episiotomy or the C-section, if you notice that area is getting very painful, or even if you had a vaginal delivery and it feels like maybe you can still feel your uterus, it feels hard, that's a concerning sign. Swelling, redness, discharge, or bleeding from the cesarean incision or episiotomy site. If the incision, like where they do either the episiotomy or the C-section, if you notice that skin starts to like break apart, then that's something that you would need to call your doctor about. If you have problems urinating, inability to go to the bathroom, or burning with urination, or extremely dark urine. If you don't have a bowel movement for 4 days after giving birth, any type of visual disturbance, or even just like severe lightheadedness, severe headache, excessive swelling of the hands, feet, or face, flu-like symptoms, pain or redness in either one or both of your breasts, pain, warmth, tenderness, or swelling in your leg, especially the calf area, persistent nausea or vomiting, chest pains or problems breathing, or reasons to call 911 immediately. And we're going to talk about this in a minute, but signs of depression or anxiety. And that's something that you're going to want to talk with your doctor about. So I talked about this at the beginning, but remember, every baby is unique. Every child is different, and you're going to figure out what works best for this baby. A lot of parents do really like having some kind of schedule or routine for the baby, just to help with this transition for everyone involved, for you, for the father, for the baby, for the siblings. Having some kind of regular schedule kind of helps everyone to have some idea of what's going on, but you also have to realize that you have to be flexible, that you can't say like, well, baby should sleep from 3 o'clock to 4 o'clock every day, and then as soon as the baby wakes up, we're gonna breastfeed for 30 minutes, because sometimes there's gonna be something that happens that messes with that schedule. So even if you have that schedule, you need to be flexible, and you don't need to get just disheartened by the schedule not working exactly like you want it to. And recognize that flexibility is very important as you have a newborn, but it's also important that you can maybe make some kind of regularity just to help everyone with this transition process. It's important too, you might be able to reach out to community resources that kind of help with you in this transition. Maybe having some friends who might also be new parents, or maybe if you're involved in your church, that maybe there's a group for new moms, or that there's just some kind of maybe mentor program, or finding other people who have been through this before, and even ways that you're struggling, that you have someone that you can reach out to. There's also going to be just the struggle of you having to take care of yourself, having to take care of your child, and also on top of that, dealing with relationship issues that might come up with your family, or just your boyfriend or your spouse. And so remember that during this time, it is very important that you recognize your feelings and that you are communicating with everyone who is a part of your life. That anyone who you're close with, that you have this open communication, because like we know in every aspect of life, transition is hard, but also if you keep everything bottled inside and you're not communicating about that, it can make things even harder. And so also, your baby at first isn't going to give you a ton of feedback about everything. It is really rewarding in a couple weeks, months, that you might hear some little noises come from them, and then as you see those smiles and those laughs. But at the beginning, it can be really hard, because you are going to be giving a lot of yourself, and you might not see all of the reward of what you're doing, and you might not always feel that connection that you expect to have, because at first the communication isn't really there between you and your child. And so you need to just know that this is overwhelming, and it's okay for you to not always feel super happy, but you need to know how to communicate that with people, and you also need to recognize what is okay and what's not okay. And so there is something called baby blues, which this is right after you've had your child. You might just be kind of down, and the baby blues is just that period. It doesn't last for long, a few days right after you've given birth, and you might just kind of be a little overwhelmed. You might be kind of sad. You might have some like tearfulness, but the things that you need to recognize is when you have had this that goes on for a longer period, this postpartum depression or even postpartum psychosis, these are things that you need to talk with a provider about. You need to be open about this with your doctor, because there are things that they can do. There's counseling that you can get. There are medications that you might need to try if this is really getting to be an issue. And you need to recognize it in yourself and know that you're not crazy if you are having these. That 1 in 7 women struggle with postpartum depression. And so having postpartum depression is not something that makes you a bad mom. It's not something that makes you a bad spouse or a bad girlfriend. This is something that just happens. And you're having physical changes, you're having hormonal changes, you're having lack of sleep, and you're just having these new roles that you're having to fill. And so this period, might not be the easiest period. And so be open with the people in your life about what's going on. Find out who are safe people for you to talk to and to get the help that you need. If you're feeling like you might have some postpartum depression or you're just struggling, I want you to know there are resources available. In the book on page 69, you can see this phone number and website. This is the Postpartum Support International Coordinators. There's online support for women that are just going through this postpartum period, whether it be beautiful and joyful or just having some just down, low moments. And this also has, if you search the area, then you can find people who are licensed to see you for this postpartum depression. There are people all around the state that are able to talk with you about postpartum depression and meet with you and counsel you in that. And when you go to your doctor, some of these things before you go to your doctor that you might recognize that you need to call somebody about are these signs and symptoms listed on the page. That would be trouble sleeping or sleeping too much. These are not all reasons that you need to go immediately, but these are some reasons that you might start to recognize, like maybe something's a little bit off and I'm not myself. Changes in appetite, feeling irritable, angry, or nervous, low energy, feeling exhausted, feeling guilty or worthless, feeling hopeless, crying uncontrollably, feelings of being a bad mother, trouble concentrating, not enjoying life as much as you did in the past, lack of interest in the baby, lack of interest in family and friends, lack of interest in sex, or thoughts of harming the baby or yourself. If you're having things like thoughts of harming the baby or yourself, you need to get help immediately. It's very important that you seek care because you need to do the thing that's best for you and for your child. But also know that this is a time that is meant to be joyful. You have this new precious baby that you have been given this beautiful honor by the Lord to get to be the mother of this child. So this is something that we want you to love and know that we are here for you to help support you in any way possible. But that being said, I know that when you have a huge task like becoming a parent, there's also a lot of things that might cause stress in your life. You might be stressed because you might feel like you're alone in this. You might be stressed because you don't know how you're going to take care of things financially. You don't know how you're going to take care of where you're living. You don't know a lot of things. But don't wait until you have the child to start to try to figure these things out. Because right now, you have the blessing of still being ahead of having that child. Take this time to start to figure things out. If you're unsure about just how you're going to have the resources, reach out to us. We are here. We are happy to support you. If we don't have something for you, we're happy to help find the resources to make those needs possible. Because just because these things are there, you might feel like, oh, well, maybe if I just give it time, it's going to go away. No, you need to go ahead and address these issues, address these things that you might think could take away from your excitement about your child, and start to recognize what these things are. Maybe just sit here right now for a minute and think, like, what are the things that are causing me stress? And the good thing about this virtual video is that you can watch this and you can sit down and write these down right now. You can write down what it is that you're stressed about giving birth, that you're stressed about that moment from bringing your child home, and know that we are here to support those things that are stressing you out. Whether it's something that we can help with and provide some way with meeting a physical need, we are happy to do so or talk with you about that. But if it's anything else, we're just happy to be here and talk with you about it. We're happy to do whatever we can to support you and the beautiful life that you're bringing into this world. Also, with these videos that you're watching, you are getting points to be able to spend to help supply those needs that you have, whether that be clothes or diapers, anything like that. And we, in our baby boutique, we have clothes up to 2T. So just because you've had your baby, we're not gone. We're still here, and we are still happy to be a part of this process. And we are happy to help find whatever it is that we can do to relieve that stress and maybe just lead you to be more excited about this time period, because it really is. It is such a blessing, and you need to just be able to enjoy your child and be able to enjoy this time period, because they're not going to be that sweet little baby for long, and they're going to grow up. And so I want you to just really be able to enjoy this process. I know that there are some dads of these babies that are watching this right now. And in this book, it talks too about that role of being a dad. And it can be hard to be the father because you might not feel as connected to the baby, or you might have a lot of other stressors. Like, how am I going to help support the baby, or how am I going to help support mom? Because she has gone through this whole thing, and just the way that it works, the dad isn't the one who gets to carry the baby or have that immediate bond with the baby. And so finding ways to spend time with the child is really important. So one thing that you need to do is just have that time just being with the baby. There's a really special connection there, just spending time together, whether that's just holding your baby and helping around with things, like whether that be changing diapers or giving the baby a bottle. Those are really important things that you can do to support the baby and to support mom during this time. And also know that we're happy to support you, because there are probably going to be ways that you feel inadequate and you feel just disheartened during this time period, because there's a lot of change going on and there's a lot of needs that are going to need to be met. So be able to find just community resources. We're happy to point you in the direction of different people who can help support you during that time and offer you the resources, or just people to talk to, because there's just a lot of stressors that are going to be in your life that you're going to want somebody to talk to. And finding ways that you can support mom is very important, whether that be cleaning around the house, cooking, or doing the diaper changes, helping with a bedtime routine, and getting the baby to sleep so that mom can get rest during that time. And again, keeping that communication open is very important, and being able to talk about your feelings and everything, because there are just going to be a lot of new changes and a lot of maybe emotions that you're not used to. So recognizing those in yourself and recognizing those in your partner, and being able to discuss those things and being able to communicate, because it's very important that you communicate with each other what those things are. And then the rest of these pages we've kind of already talked about, but I'm just going to give some little pointers on each thing. We talked about the getting around on your own, and moving around is important. It decreases the risk of other problems. It decreases the length of time that you will need to be in bed. It decreases the pain that you'll have from your incision sites. It helps with the healing process, but also know that you might need some help getting around at first. Hygiene, we had talked in some other videos too about those little bottles for cleaning the incision sites and making sure that you stay clean when it's hard for you to wipe as easily right after having a baby. So you can use those bottles to help with cleaning the vaginal area. You can also do some of the sitz baths, where you're just kind of sitting in just a little bit of water just to get that perineal area or the vaginal area cleaned. Also, for right after the cesarean, remember, if you have had to have that C-section, make sure that you're keeping that incision clean, dry, and recognizing if there are any issues, if it gets to being tender, if it turns red, starts bleeding a lot, or starts to come apart. Remember, you need to contact your doctor. With bathing, showers are usually better for you to do right after, and you can start doing showers as soon as you can walk. But you might want to hold off on taking baths, and you'll want to talk with your doctor about what they tell you to do at that time. Remember, you should not be doing any vaginal douching. It is important that you don't put anything into the vagina soon after you have had your child. That means no douching, no tampons, and no sex right after until you've talked with your doctor about it. And then resting and sleeping. You need to just find time for you to rest, and you need to get plenty of sleep because it is going to be a hard adjustment, and lack of sleep makes it even harder. So find ways that you can get some sleep. You're not going to sleep the way that you did before you had a child, but you're going to have to find the ways that you feel like you're getting enough rest so that you can take the best care of you and the best care of your child. And then we talked in another video about diet and nutrition, but just remember that it is important that you have a good, well-balanced diet because of a lot of reasons for your health, just as you are starting to lose some of that extra weight. But it is also important that you get enough calories. I know that you might feel like you need to be losing a lot of weight fast, and that is not true. You need to make sure that if you're breastfeeding, you need to make sure that you're getting enough calories for you to be breastfeeding. And you need to make sure that you're getting enough protein so that if you have any incisions, more protein is going to help that those incisions heal better. And so you need to make sure that you have plenty of protein in your diet, and that's going to be like your chicken or beans, peas, nuts, and find ways that you feel that you enjoy getting that protein and get that into your diet. All right, lastly, I just want to stress this is a hard time. This 6-week period after birth, this postpartum period, you're going through a lot of physical changes. You're going through a lot of emotional changes. Be patient. Be patient with your body as it starts to go back to how it was before you were pregnant. Be patient with your baby as you learn how to take on this new role and learn how to just adjust to everything, and be patient with the people around you. This is a really exciting time, and you have been given this beautiful opportunity to raise this child, and know that you are not alone. You are always able to reach out to us, and we are happy to support you in whatever way we can. Congratulations on this time of becoming a parent, and know that we are here with you, and we are excited for you as you become a mother.